My name is Dr. Julie Wei. I'm a pediatric otolaryngologist, or an ear, nose, throat specialist who treats children. After many years of seeing and caring for children who come to see me for chronic nasal congestion, chronic cough, sore throats, amongst other problems, I have come to believe that a possible cause for many of their symptoms are really related to what they eat and how they eat.
I had so many visits to doctors that I really didn't think there was hope.
I would be looking at my then 9 and 10-year-old daughter with tears rolling down her face saying, "Mom, I think I'm gonna die."
She'd been very sick, off and on, for 2 to 3 years.
All the other doctors did not know how to help me.
Blowing her nose constantly, waking up, feeling miserable all the time, continuously adding medicines. Every time we would go to see her asthma specialist, it was adding another medicine or doubling this medicine.
I mean, she was on, steroids even. Little kids, steroids wreak havoc on a respiratory system.
Many moms say they're better while they're on the medicine, but as soon as you come off, the junk is there again.
In my chest, it hurt. It was so sore from coughing, and my throat hurt so bad.
You wonder, how many people can she see? How many people can we go through before someone finally gets it?
So many of these families swear to me their kid was healthy the day they were fine. They ate dinner, they were fine, they went to bed, and then middle of the night, they hear it.
Croup is a very severe cough that is characterized by a barking sound.
It usually is preceded by a fever or upper respiratory type infection.
After many years of asking every family that comes through my office what their children's dietary habits are and what they eat, as well as what time they eat, I've come to appreciate that many children like to eat a snack after dinner, and especially a bedtime snack. And these are often food items that are high in sugar and dairy. So I believe that because they're going to bed with undigested food and liquid in their stomach, then they may have backwash, or what we call reflux, that then contributes to these symptoms for which the parents and caretakers seek medical attention.
Dr. Wei had us change her diet to stop eating and drinking after 6 p.m. because Emma goes to bed at 8, so it's about 2 hours before she goes to bed.
We started a treatment plan at that point, which included, what and when she ate. Now, a typical evening for us is her not eating past 7.
Quinlan is not to eat after 7 p.m. If she does, we get symptoms the next day. It is like clockwork.
Well, 6 hours is about the time that it takes for your stomach to empty. If you do eat a meal, it takes about 6 hours for that meal to leave your stomach and go to the rest of your intestines. When we put patients to sleep, you all of a sudden lose your airway reflexes. And what that means is that if something were to come up out of your stomach while you're asleep, it can actually go down into your lungs, which could be very detrimental.
I think just for her on a daily basis, it's just less medicine, it's less to deal with, it's more able to just be a child and get up and play.
She is a different child now.
Every patient I see when they come into the emergency department in the evening, is it croup or now? I'm really double thinking myself and saying, it truly could be something else.
Even though I have a modified diet and I have to take a special medicine, it's all worth it.
So many doctors did the exact same thing for such a long time. Why did it take so long for us to find her?
Well, I'm free. I'm free now.
It is my observation that children today who are otherwise healthy seem to be on more prescription medication than ever before. It is through this observation that I started paying more attention and try to see if I can make them better by modifying their diet and their dietary habits. Because children are on so many medications, and this is significant to not only the patient, the families, and our healthcare burden altogether, I think that this is a problem that deserves our attention. Even though I trained as a physician and surgeon, some of the greatest impact that I have been able to make in the lives of young patients and that of their families have resulted from neither medication nor surgery. Based on my experience, I hope that both healthcare professionals and caretakers will take a closer look at what can be achieved through dietary changes so that children can avoid unnecessary medication and surgeries.